Hello, everyone, and welcome to today's seminar. My name is Sean McMahon, and I'm the Program Manager for the Lister Hill Center for Health Policy. I'm very excited to welcome you to today's webinar on the policy implications from the COVID-19 Race and Students and Postdoctoral Fellows Mental Health Study. Before I introduce our speakers, I would like to point out a few things on your screen. This webinar is available in a listen-only mode. So please use the Q&A box at the bottom of your Zoom window to submit questions for our speakers. Additionally, we are providing live captioning for this event, which can be enabled through the bottom menu as well. If you experience technical issues, this webinar will be recorded and it will be posted on our website for future viewing. And now it's my pleasure to introduce our amazing speakers for today, the principal investigators of the COVID-19 Race and Student and Postdoctoral Fellows Mental Health Study. Dr. Robin Lanzi is a professor and the graduate program director for the Department of Health Behavior at UAB's School of Public Health. She is also the National Director of Community Engagement and Translational Sciences with the National Center on Health, Physical Activity, and Disability. She is also the faculty director for the UAB Mental Health Ambassadors Program. Also with us today is Dr. Angela Stowe. She is the Director of Student Counseling Services at UAB. She's also an adjunct professor for the Department of Health Behavior, as well as the chair of the UAB Suicide Prevention Initiative. Dr. Stowe is also the clinical director and co-founder of the UAB Mental Health Ambassadors Program. And also potentially joining us a little bit later on is Dr. Lisa Schwiebert. She is the Graduate School's Senior Associate Dean for Graduate and Postdoctoral Affairs. She's also the Interim Dean for the Graduate School, as well as a professor in the Graduate School. So yeah, with that, I will stop sharing my screen and I'll turn it over to y'all.
Thank you, Sean. Dr. Stowe is going to share her slides or our slides, and I am going to start and do our agenda and then talk through the first part of our presentation, and then Dr. Stowe will share the second part of the presentation, and hopefully we'll have Dr. Schwiebert here for our round of discussion. So in terms of our presentation today, we're going to start off just reminding us about the background of our study, what it is, and a little bit about our findings for the broader study. And then specifically what we're looking at today is about what students identified that they need in terms of support from UAB. And so we'll dive deep into that, talk about the 6 themes that we discovered in doing these analyses and of what students shared, and then help describe those around a framework, the social ecological model, and sort of 3 areas involved with that, and then dive into what we are calling our call to action in terms of recommendations of how we can address what students said that they need from the individual level and a personal level, and then the organizational level. And then we'll round it out with discussing policy implications for UAB and the broader community, building on what students themselves identified that they needed. So we are looking forward to diving into that.
Do we want to take a second to introduce Dr. Schwiebert since she was able to hop on?
Yes.
Thank you all for joining. I'm excited to be here and discuss through what I know is going to be a really rich conversation.
Thank you. All right, so next slide, please. All right, we definitely want to recognize all of our core research assistants, as well as those who have worked with us on conducting this research and writing about all of this great work. And so we have Dr. Lawrence Botet, Grace Albright, Dr. Amy Hudson Chatham, who actually utilized this for her doctoral dissertation. And so we're very thankful for her work on that. And then Claire Eastep, Dr. Sherilyn Garner, and Kalani Upshaw. who have worked with us on this, and then additional research and writing support, as you can see here, from a number of undergraduate, graduate, as well as postdoctoral fellows. And so we think the beauty of this is that one of the wonderful things about this is that we've had participation from across the spectrum of students and the university setting, as well as postdocs. And we do want to recognize our funders. This originally emanated from the UAB School of Public Health Back of the Envelope grant. And building on that, we were able to receive additional support through the graduate school, through and dedicating some of our faculty research funds, as well as getting support from the Office of Service Learning and Undergraduate Research. We have 3 phases to our study. We're currently in phase 3 of reporting back currently, and through these public forums, as well as through focus groups and then individual meetings that we're having across campus. Phase 1 was during the summer of 2020 when we conducted an all-campus anonymous survey. And as you can see here, there were originally over 1,500 students and postdocs who started the survey. And then we had over 1,000 who went through the entire 61 questions and answered those, which as you can kind of think back to what was happening in this world back in the middle of the summer of 2020, for students to take that much time to do this anonymous survey that they were not paid to do, but really because that it dealt with a lot of what students were going through. So we were really thankful and appreciative of the students and sharing. That was the phase 1 was conducted from July 2nd through August 19th. And then our phase 2, our longitudinal study, was conducted from basically through the academic year of 2020 to 2021, the fall and spring semesters. And we have 120 students who originally enrolled from a number of sort of undergrad, grad, and postdoctoral fellows, as well as different backgrounds. And so we are looking forward to sharing results of those as well. And so today we are reporting back and as phase 3. Next slide, please. So in terms of our sort of call to action, our recommendations, these are built upon our that summer 2020 all campus survey. And so we wanted to share here a little bit about the demographics. And as you can see here, over 600 were undergraduate, over 600 were graduate students. We had over 100 professional students and 58 postdoctoral fellows, which is a significant number of our postdoctoral fellows. We had both US citizen and non-US citizens who participated, and across the spectrum in terms of age and race and ethnicity, as well as gender. We had all of the schools across campus represented in terms of students responding, also students who reported identifying across the spectrum in terms of a number of identities. And so really nice demographics representing our students who responded. So specifically what we are digging into today for our presentation is on, and I put up there question 61 to just emphasize the point that students really went through 61 questions where some were quantitative, some were qualitative. So some they would rank or rate, and then others where they would share their thoughts and explain more why they gave a particular quantifiable answer. And then the last question we wanted to, and it's worded here, and I'll read, to ask them about their thoughts. And so it says, share your thoughts about what you need from UAB to support your mental health. We want to hear from you. Our goal is to work with students to come up with actionable, sustainable strategies that address shared needs. And so we felt it was very important that we heard from students after sharing what was going on for them, and across the domains of academic, as well as mental health and their research, and things that were happening in the world, and what was it that they felt like would help them best meet their needs. And so what we did, next slide, please. We use qualitative coding for this. So we took each of the responses from those who completed the survey, uploaded those into this qualitative software. It's called In Vivo. And then with our highly trained qualitative research team, we reviewed each and every one of the responses that were provided, discussed them, and through this iterative process, their codes were developed for their responses. And then from those codes, themes were then created. And then we discussed again these themes by the research team, and then further delved into the themes, and some of those themes have sub-themes, and then a summary report. And so now we are sharing with you some of these findings. So there were 6 general themes that through this iterative process that came to light, and they're listed here. So the first being communication concerns, and we'll dig into what that exactly means. And then other areas that talked about were academic concerns, their mental health concerns, COVID-19 safety concerns, social injustice concerns, financial concerns. And then there were a number of students who said that they did not have any concerns, or they were satisfied with the support that they were receiving. So let's get into each of these. And so in terms of communication, as you can see here, students were sharing with us that they had requests for overwhelmingly a desire for clear communication from the university. They expected that this information to be timely, transparent, and trustworthy. Interestingly, undergraduate students expressed this concern significantly more than graduate students. With this overarching category of communication, there were sub-themes, as you can see here. Clear direction from the university. They wanted the university to reach out to their students. They wanted them to listen to the students once they were reaching out, and they wanted to have clarity about class requirements. Here's an example of some of the quotes that, again, this is students who are typing this out on their own as just sharing their thoughts. This is not for a class, it's not for a grade, it's not for payment. This is students sharing what they need from UAB. As you can see here from the first quote, I think keeping lines of communication open, town halls, anonymous suggestion portals, student outreach is what's going to be most important right now. A lot of faculty, staff, administration has been framing the situation as if this new normal isn't traumatic, when indeed it is, even if some of us are coping better than others. Another student shared, encourage professors, advisors to check in with students to see how they're doing. It means a lot to know that someone cares. Another student said, we need people to listen to us. A lot of students are struggling to learn. Every time we ask for help, our questions fall on deaf ears. Okay, moving on to academic concerns. For this, as you can see, our analyses revealed that addressing some aspects of academics will provide student support for students' mental health during unprecedented times. Major themes that emerged from what students said address the way in which classes were taught and how students were treated in regards to coursework. And as you can see here, there were some sub-themes there indicating that they needed compassion for their need for compassion and understanding. Second, being class structure and the platform that it was offered. Next, being flexibility and course adjustments. There were a number of undergraduate students indicating that there were unique graduate student needs and that they wanted those to be addressed. And then around student solutions. Here you can see a sample of what some of the students shared, and I won't read all of these, but highlight some of those. I think the main thing is just to be mindful. It's new to a lot of people and you don't know what someone might be going through. Another one shared, continued support from professors in class really helps. It's relieving when they acknowledge we are humans and not robots, navigating a very strange and very tough global event right now. Another student shared, I feel like anxiety is an all-time high for most students. Anxiety makes it difficult to keep responsibilities organized. And I think the best thing would be for faculty to be understanding that students are trying their best. The last quote on here shares, I am beyond stressed at the thought of being forced to attend classes in person this fall in order to continue my education without falling behind. Okay. The next theme here related to mental health concerns. The major themes, as you can see here, that emerge from the data address the ways in which classes are taught and how students needed to have support. So their need for compassion and understanding. Oh, wait, sorry, listing the wrong thing here. But counseling support. So in terms of their writing, students made it clear that they for sure needed counseling support, but that was not the only support that they needed. They needed support beyond the ones that they were typically getting. They needed specific mental health resources. They needed help with making social connection, as this is a very different time in the ways in which students are needing to connect. So here are some examples. I think better counseling services as well as increased counseling services need to be made available. Between the pandemic and all of the racist happenings, students, faculty, and staff are all facing difficulties and may not have had the time or resources to get the help they need outside of the school. Another one shared, I think it would be really cool if UAB offered an online counseling service or app to support students, especially during COVID. And the exciting part is, of course, that we get to report on some of the from what students shared and how their words were taken into account and shared, and many of these things are being addressed. And so excited to share about those. More advertising about what mental health services are available, and maybe a listing of the steps to get started. I know that there is counseling available, but I've never looked into it because I never knew what the process would look like. Another quote is, I need help deciding what career options make sense for me now. COVID-19 has screwed over all of my life plans. Now I don't know what to do. Okay, moving on to the next theme.
There's a second slide of quotes if you want to highlight any of those.
Yes, thank you. Mental health resources quotes. So as mentioned, there was counseling, and this is the sub-theme for mental health resources. I think more seminars, webinars on general mental health topics or coping techniques would be beneficial. They could include discussing anxiety, tips for scheduling your day, or adapting to a new work routine, for shift work and research, or ways to practice mindfulness. Another was a forum for students within the same year to talk about their struggles progressing. Another student shared, in previously stressful times, I've benefited from signing up for notifications where I'm sent positive thoughts or encouraging messages daily. It would be nice if UAB provided an option such as this to either be emailed to us or sent to our phones for little happy reminders. And then the last quote here is mental health awareness from teachers and faculty, cultural humility from all teachers, staff, faculty, administrators, etc. And this one relating to social connection. I need to be able to interact with and study with others. I cannot be alone all the time. School is too hard and stressful to be by ourselves all the time. I still need a college experience as much as possible within the realm of being safe. And as you know, some of us have talked about, and others, how for many freshmen, this is like last year's freshmen, we now are having essentially two kind of cohorts of freshmen, sophomores who are having these new social connections. And so Dr. Stowe will talk about some of these. Second point, I would prefer socially distanced events that can bring some of the joy of being around friends and peers. It would also be good for these events to be planned in advance so that people can know what to look forward to in the future. COVID-19 safety concerns, and these related around two areas, sort of the general health and safety, and then the on-campus safe spaces. Some quotes here. I need the ability to study on campus for as long as possible, even if that means all classes are online and all I can do is go to the library. I can't study at home because I have 5 siblings who live here and it's not a good academic environment at all. I think one of the biggest things I need is just for UAB to not panic and close the school and dorms all of a sudden. Another student shared, please make sure students are safe upon returning to campus. There's so many young people who refuse to take the pandemic seriously and it only hurts the rest of us. A third one is I need to know UAB will be a safe space to learn in these uncomfortable times. I need to know the university has the financial, emotional, and physical interest of the students in mind when reopening. Social justice concerns. These were 3 sort of sub-themes here. Leadership taking a stand against racism. The second being safety measures to prevent discrimination and respond to harassment. And then the third being institutional policy reform. Here are some quotes. I'd also like to see the administration and leadership to be more vocal about the race-related issues currently facing our community. A second one, I just need to feel safe on campus, whether it be safe from COVID or racial injustices going on. A third student shared, don't forget about what other persons of color, like the Asian race. We were attacked from the moment COVID-19 arrived in America. We are victims of racism and racial injustice as well. The fourth student shared, I feel like special treatment is happening all around me to people of color. We do not necessarily want special treatment. We want to be treated like everyone else. I'd like to be appreciated for what I do, my accomplishments and my pursuits, not because I happen to be Black. The greatest insult is when white people try to accommodate so much to make sure I feel safe and that I feel accepted. Those actions alone create a separation between the 2 races. The next area, financial concerns, and these were in sort of 3 areas, tuition and financial needs. The second be scholarship consideration regarding eligibility and grades, and then the third being future scholarships. Here are 2 rather lengthy quotes. The first one being, although it's a lot to ask, I would hope that the university could be more lenient when it comes to academic scholarships for those struggling mentally and physically from the effects of the virus, including the switch to online classes. It can be very difficult to keep up with the same hard work and habits when put into such a confusing time and situation. While some are trying their best, it can be very difficult to maintain grades. The next one, I think the thing I need the most from UAB is food security. Knowing that I have money on my UAB card and having the stability of always having options would make my life a million times easier. Before COVID, I was able to save so much money for rent and utilities by not having to worry about food. Okay, so I'm going to turn it over to Dr. Stowe now, who's going to talk about a call to action. What do we do?
All right, thank you, Dr. Lanzi. That is a lot of information boiled down into our 6 overarching themes. I hope you found the quotes as rich and powerful as I know we did going through the research to see how these themes really come to life and what it means through the voice of students. We have so much data, and it was hard to pick which quotes would most represent what the student voice was, but I do think it's important to have those words as we think about what does this mean for us and our call to action in terms of practice, in terms of policy, in terms of ways that we are able to create initiatives and programs that do support our student mental health. So we're going to present really our model for our call to action recommendations. And we look at this through a public health approach with the social ecological model through the organizational, interpersonal, and individual levels. And so we're going to present recommendations that really address each of those levels so that we can think about the whole public health approach to looking at mental health on our campus for students. And so our recommendations are 6 recommendations for the organizational strategies. And we want to articulate and implement a communication strategy for students that's clear, timely, and transparent. Provide institutional-wide guidance to faculty and staff about expectations and role in supporting student mental health, and articulate and implement a clear social justice plan to effectively address racism that impacts students and their mental health. Interpersonally, we have one main strategy that we really want to focus on recommending is providing training for faculty and staff on how to support the unique student mental health needs. And then to meet the individual needs of the students who do have mental health concerns, we want to look at providing a broad range of mental health support services in addition to counseling, and then proactively address personal and academic and financial challenges that they have. So we're going to break that down just a little bit more detail and explore it some. And I encourage you, we do have a focus group after this. We'll also hopefully have some time for questions and discussion, but would really love your feedback and ideas on this call to action, specifically as it pertains to UAB and our students. The first recommendation is to articulate a communication strategy for students that is clear, timely, and transparent. So of course, our strategies are going to emerge and come from the themes of what students said that they need. We really want to recommend a campus operations plan, particularly when we were in the middle of the pandemic. Students wanted information that would help them know how to plan and prepare as much as anybody could plan and prepare during a pandemic. But what's coming up? What do I need to be thinking about? What are we going to be doing to address my safety? What are we doing to address my access to education? What are we doing to address our opportunities so that I can continue my education and reach my goals that I'm here for? And that includes the safety procedures as well for the classrooms as we returned in person, making sure that I can learn as well as maintain my safety. There was a lot of discussion around course guidelines and expectations, especially as we saw the shift, to online learning. I know immediately in the spring of 2020, there was a lot of just really quick regrouping and figuring out how to finish the semester. As students entered the fall, faculty had had a little more time to plan for the fall as much as possible, but teaching and learning in a very different format. And so students really needed more information about what the guidelines and expectations are. And as we know, faculty were also learning some of that while they're teaching, because it was such a new way for many people to teach as well as learn. And then thinking about the student consideration of student choice in learning platform, whether that's going to be a hybrid class or online class or in-person class, and how they can best learn. Our second recommendation is providing institution-wide guidance to faculty and staff about the expectations and their role in supporting student mental health. So making sure that as an institution, we're on the same page and we're clear about what our role is. There's lots of research and experience that show us that student mental health does impact their academic progress and their ability to perform academically. And so we recognize that connection. So what does that mean for us? Because for most faculty and staff, addressing student mental health is probably not part of the job description. It's probably also not one of the characteristics or qualifications that people list on a vita or job description. And so let's think about what our role is. It is very important that we make a statement about the priority of student mental health and well-being. For example, for UAB, we recently became a health promoting university. Or Dr. Watt signed the Okanagan Charter back in December, making UAB the first institution in the United States to make this commitment to be a health promoting university, meaning that strategies, policies, and programs addressing health, including mental health and well-being, are embedded in all that we do. And so that's a way to prioritize. It also means thinking about budget decisions and is our money put where student mental health and well-being is going to be supported. So a clear statement about the priority. Secondly, promoting compassion and understanding by encouraging check-ins and outreach. As a culture of care is what we're talking about, from institution-wide organizational strategy, that we check in with each other, that we are encouraging, whether that's a check-in poll anywhere from a faculty member to get a check on the pulse of the students, or that's a, hey, I noticed you haven't been coming to class in a while. I want to check in and see if everything is okay, as well as checking in with colleagues. So this is something as an organization for us to be moving towards and creating a culture that promotes compassion and understanding. Practicing deep listening by offering feedback opportunities. This was another theme that came up from our students is don't just ask for our thoughts and our feedback, but are you listening? Are you hearing? And so we really wanted to emphasize deep listening. And that means in terms of our response and creating intentional times for students to provide feedback. For example, our forums that were conducted for students and town halls that were conducted throughout the pandemic for students to be able to get information, but also ask the questions that they had of our senior leadership. Many of our schools throughout UAB also hosted forums and have over the past year and a half to give students, again, another opportunity for their voice, and then have been in different ways across the institution, letting students know we hear you by providing back what they've been asking for. Another strategy is to endorse flexibility and consideration while providing options and defining scope for adjustment. And so what this means is, and I would say that from the provost level in particular, that this has been a strategy that has been implemented regularly, is encouraging flexibility, while at the same time, we've got to support our faculty and staff in maintaining those course and program standards so that students do learn and do achieve the competencies that are intended as a result of taking the course, but also recognizing that individually there are very extenuating circumstances that are impacting a student's ability to progress academically. And we do need to take those into consideration. So how to have that balance, and that again comes from an organizational, institutional level, so that on that faculty to student level, that can be given and provided. And then promoting intentional and widespread mental health resources for students, faculty, and staff. So we want to make sure on an organization level, these are being promoted. One example of the way that UAB implemented this, particularly over last academic year, would be at the town halls that counseling services. I made a regular appearance to be able to provide information as part of that overall town hall about mental health and services and support. At one point in time, a student gave that information, or Dr. Kennedy, our Assistant Vice President of Student Health and Wellbeing, but there was time set aside in our town halls to address mental health. And so that was using those resources. We also have the suicide prevention leadership and implementation team, our UAB Care Suicide Initiative, that also comes from an organizational level that pushes out information for crisis and suicide support. That's another response that was launched during COVID in the summer of 2020. And then the leadership team continued to make sure that we were intentionally promoting mental health resources. And then finally, the app that was created, and again, our organizational support of a mental health app called Be Well UAB, and from an organizational level, pushing out these resources are available. I'm going to pause for just a second and I see a couple of questions coming in, so I wanted to take a minute to check those.
Yeah, so there's really in 3 different areas that the questions are asked. One is, was there any follow-up with students who listed food insecurity as the top stressor after the reopening of Blazer Kitchen? Any data showing that this on-campus program assists in decreasing the stress levels of the students? And then another one related to teachers balancing the mental health needs of students with academic demands. And then the third relating to if there's any data showing the pandemic's impact on students' grades and overall performance. So we can entertain those now, or would you prefer to do that at the end, Dr. Stowe?
I'm happy to do either way. We can just pause, since we're already paused here, we can go ahead and address those. So as far as the food insecurities, there are a couple of sites for Blazer Kitchen on campus. The one that students most frequently use is the one that's located in Hill Center, and they do have a lot of data about utilization, but I honestly don't know that anybody's done a study on really connecting the impact of having Blazer Kitchen and also other food support. Sometimes there's meal vouchers and Blazer bucks that are provided, so not just food and supplies themselves, and how that directly impacts stress levels. So this was submitted by an anonymous attendee. If you have research interest, that might be something to look at. I think that would be a great research question to pursue. We know there's high utilization. There was before the pandemic. This is not a new concern with our college student population, but they have definitely continued to see high utilization of the food sources. How do we balance the mental health needs of students with the academic demands of the course load? That is a great question, and one that I have heard among many faculty and staff is that challenge of balance. I encourage you to consider attending one of our workshops in the Center for Teaching and Learning. There is a workshop that is supporting student mental health during the pandemic, and certainly now as we're shifting to yet another stage of the pandemic. And this is exactly what we talk about. And those are available monthly through the Center for Teaching and Learning. And again, another response to the research that we have found through our study of what we put in place to provide for some of the needs of faculty. And so
I could add to that before you move on to the next one too, is, and yes, I just do want to credit Dr. Stowe too and her team in putting in so much with e-learning for us as faculty to have. There is all of us as faculty have the Supporting Student Mental Health Canvas shell that they developed in response to this. So there's lots of resources in there, presentations that we can use, different resiliency tools that we can use to help support our students. There's also a syllabus statement that we can use that we can share with students, sort of get ahead of it a little bit and sharing our sort of thoughts on this and coming to me first before it becomes an issue within this specific class, how we can meet those needs. And so really talking with your students from the beginning in this class. Here are going to be some touch points where things may become stressful times, or, we all know sort of there's certain, midterm periods or end of semester, even if it's in graduate school with sort of different things of like final exams, but more papers that are due and research that's happening. And so I think it is definitely this nice balance between wanting to meet the mental health needs of our students and of course trying to meet those academic demands. But thankfully the student counseling services has put a lot in there for us as faculty to use. And then really, I think this wonderful concept of sometimes essentialism that Dr. Stowe and I have talked a little bit about here lately, and really what is essential for the class. And if you do have that flexibility and what is essential that semester for your students is something we can reflect on, I think, as faculty as well. And recognizing, there are so many things that students are going through and so many factors that they need to look into, and are some things that we're asking of them that we don't necessarily need to ask of them, that often they're kind of reinforcements of concepts or additional opportunities. And so if there are some things that we can make optional or as additional things that activities that they could be doing, I think is another area that we can look to as ways to help support their mental health needs. So just wanted to add a little bit. Thank you, Dr. Stowe.
Yeah, thank you for that. And I think that question really shows a connection between the organizational strategies and the relational strategies that we're going to talk about as well, because they really are connected. In order to be able to deliver that flexibility in the classroom, to make adjustments as needed to your curriculum and as you can, and to support student mental health, we've got to have that from an organizational level embedded in our policies and practices and our senior leadership philosophies and in our where our money is invested and used. So the third organizational strategy is to articulate and implement a clear social justice plan to effectively address racism that impacts students and their mental health. And so we are in the process of getting out additional information from our study that really digs deep into the experiences around the events of racism that our students experienced in the last year, and to share that out as well. And we learned that students are impacted and have been impacted directly and in big ways from these events, and just racism in general that is, occurs way before the pandemic. So some of the strategies that we recommend that come out of the themes from the research is to implement programs and policies surrounding support for students of color. That we are at a predominantly white campus, and that's really important for us to name the campus that we are. And so we need to be intentional and make sure that our students of color and our BIPOC students do have programs and policies that support them. We need to enforce and develop safety measures for policies addressing discrimination and hostile behavior. So one of the things that has happened in the past year through leadership efforts is that Dr. Watts, with the support of our Diversity, Equity, and Inclusion Office, and Dr. Dilworth, has said UAB strives to be an anti-racist campus. And so if we're going to be an anti-racist campus, then what policies, procedures need to be in place to protect our students from discrimination and hostile behavior that may occur? And then to openly discuss issues of race and racism with students. One of the results of that happened during the pandemic was UAB formed the Racial Equity and Justice Council, Racial Equity and Justice Task Force that is led through the Office of Diversity, Equity, Inclusion, as well as the Office of, it's Human Rights. What's the name of that office? It just slipped my mind. And so this brings together people from the entire UAB enterprise, students, faculty, staff, administrators, as well as community members, to think about how we as an institution are going to move forward to be an anti-racist institution as a member of our community, to provide leadership to our own students, faculty, and staff. And we have to be able to openly discuss issues of race and racism. Additional training has been developed as well for faculty and staff through Diversity, Equity, and Inclusion to help us be able to do this better. So there's a lot to unpack certainly in these strategies, but our students made it clear that this was a priority for them in order to support their mental health, because these experiences are impacting them. For the interpersonal level, which is going to be more of that relational level, so student to faculty is probably going to be the biggest place that we're going to think about this. So we have one recommendation for the interpersonal level, and we've already really started talking about that, and which to me shows how important it is that we provide training for faculty and staff for supporting student mental health needs, about how to do it, not just the needs that need to be supported, but how do we do this? This really was clear in my personal experience and in our requests through student counseling services about how to support students. We've seen an increase in the number of students reporting mental health concerns to their faculty, and an increase in the risk level of what they're reporting to faculty. So higher acuity, higher risk, things like suicidality and self-harm and not being able to go on, and faculty need to know what to do to effectively and appropriately respond. So the strategies are to teach faculty and staff how to provide student support through compassion, understanding, and acknowledgement of struggles. So this is going to be some of the skills that we're talking about. To be able to identify and respond to signs of concern. So how do you know when somebody might be experiencing some mental health concerns, and how do you know when to intervene or when to respond or when to reach out and say something? Knowledge of the resources that are available. I think this ties directly to the organizational strategy, but if our faculty and staff aren't able to speak to a student and connect them with the resources that could help them, then we're going to miss a step. There's going to be a gap there. So we want to make sure that not only are the resources available, but faculty know how to share those with students, and that there are additional strategies to promote mental health through teaching and course design. So a couple of the key resources that were created as a result of this need and this strategy is, one, the Canvas course that Dr. Lanzi spoke to, that is support student mental health through teaching. This was made available to every teaching faculty and staff on campus, available in your Canvas dashboard. And if you don't have access, for example, if you're a graduate teaching assistant or you're a graduate student teaching and you need to have access or want access to this class, then we can request to have you added. We also have the in-person workshops through the Center for Teaching and Learning every month that I mentioned to, again, provide additional training. And then a lot of our departments have requested training specifically for that faculty. And additionally, the other way that we really helped last year as a response to this need is in partnership with eLearning and the Center for Teaching and Learning. Pam Poshton, Scott Phillips, and I went really on a tour of all of the schools and presented about course design with mental health in mind, about responding, and also some proactive strategies as people were beginning to teach the spring semester about how to support student mental health through that teaching role. So this has been a big area of need for our campus. It certainly was identified as themes that came out of what our students said that they need. And those are several examples of how we have responded to that. All right, and then the last area of the social ecological model is the individual level, and this means how we are responding specifically to a student's need. This student has a mental health concern, and how are they going to be able to get the assistance that they need? So definitely students, had a lot of comments about counseling services. That's going to be really probably the first thing that people think of. It is the biggest thing that we provide in terms of student counseling services, is that direct care, counseling appointments, some therapy to help students get the support that they need. We also had a lot of feedback from students about the additional resources that they needed available. Not everybody needs counseling from a professional, but people do need mental health resources. So there was a real clear charge to us that we need to provide a broad range of mental health supports. Access to resources that inform students about coping, self-care, grief, and stress management. So in addition to, we've got a number of workshops that we provide. We also have an app that is a self-help app that has 150 modules of things like dealing with procrastination or motivation, depression, how to change your thoughts, understanding your substance use. So a number of topics that students can go through a structured, really course on their own and gain a lot of, it's really based on cognitive behavioral therapy. They also, we also have a number of workshops that students can request. Our Blazers Bounce Back, Control the Controllables. But one of the things that we did in response to this through COVID to make sure that students, there are a couple of things I want to highlight as a response to this, was putting our Blazers Bounce Back resiliency course in Canvas that could be available in a self-help way at any point in time for students to learn how to build their resiliency resources. The other program that really grew and emerged as very important, we learned for our students through COVID, was our mental health ambassador program. It was actually envisioned by Dr. Lanzi, and I was honored to join as a partner along with honors student at the time, Juhi Agrawal. And we, through Dr. Lanzi's Faculty Fellows Project in the Honors College, had started the mental health ambassadors just prior to COVID, got them trained and their ideas developed right in time to go virtual. And at that point in time, through Dr. Lanzi and Juhi's leadership and quick acting, we were able to turn all of those student programs into virtual and online support for peers throughout the entire next year of COVID. And so again, they provided information to students about how to cope. They did workshops. They even implemented a peer-to-peer kind of phone check-in program during that time. Peer mentoring is also a suggestion and something that students talked a lot about. One of the things, a couple of the things here that I think have been important that emerged through COVID as well as a response is GROW, which is our Graduate Resilience Outreach and Wellness Graduate and Postdoc group. And I think Dr. Boytett is on the call, as she and a couple of other folks founded this group. But they started a partnership with the counseling program graduate students, and once a month offer a de-stress power hour where students come together and they're able to have that peer support about being a graduate student and postdoc, and it's structured with topics to help them manage. We also have recently acquired, again, as a result of students saying this is what they need, a platform called Togetherall that we purchased and now subscribe to, that connects students with an online peer network all over the world of other college students. And so they're able to to be able to be connected in that way. Other things are just to promote belonging and connection, and then have institutional messaging that includes encouragement and positivity to motivate students. This actually got pushed out in an update of our app. The Be Well Mental Health app now has notifications that users can get at a kind of different intervals that have just messages of encouragement. And then finally, our last recommendation that I want to share is to proactively address the financial challenges, both personal and academic, that are impacting academic success and overall mental health. Financial stress is a huge source of stress for many of our students, and most definitely impacts mental health. Some of the things that can be considered to help students on the individual basis is flexibility with scholarship and loan requirements, access to emergency financial aid, which was set up pretty immediately through the Division of Student Affairs. With some emergency funding, students were able to get laptops so that they could work remotely, and these were loaner, but really loaner for as long as students needed them. We continue to have emergency financial aid available for students now. Resources to assist with food and housing insecurity, that we have found that continues to be a need of our students, as we've already discussed. And then increasing student employment opportunities. One of the things that was implemented over the course of COVID that helped support some of this is that our work study program was 100% funded, so that departments and areas in the university could hire more students, and those positions were 100% funded to provide more employment opportunities. So I've kind of woven in the policy implications and impacts, but I'll pause here and shift over to open it up. I know we have just a few minutes left for this part of the discussion. If Dr. Schwiebert, Dr. Lanzi want to chime in and add anything to what I've shared, and then we can maybe open up for a few additional questions and discussion.
Thank you both. I mean, just amazing information. As was mentioned, we have so much data to dig through and so forth. And albeit these surveys and data were collected now over a year ago, I think it's still very timely. And we find ourselves maybe in a different phase of the pandemic or endemic or what have you with regard to COVID and continuing social injustice, racial injustice. So again, I think these ring very true today as they did when we first collected them now several months ago.
Thank you. And I will just add that the efforts continue. We continue to meet with Dr. Dilworth, Dr. Jones, all of the deans we are reaching out to. We're reaching out across the board to see how we can continue to share our findings, continue to meet with student groups, and sharing back the findings to continue the dialogue. This is not a one and done. This is, I'd like to say, more of a conversation of how do we continue to support our student needs. And we do want to recognize and acknowledge and thank UAB for all that they do and have continued to do through their leadership, since the beginning of UAB, particularly through this pandemic, as we know that, it's, I've heard it's sort of like, flying a plane, that not trying to figure it out while you're, it's going on. And so there has been a lot of trying to figure it out along the way. But we appreciate the administration, the deans, the faculty, the staff who have continued to rally and support our students and look to ways that we can support student mental health needs, their academic needs, their financial needs, the social injustices. And so we are thankful for what has been done. We believe in UAB, we believe in our students, and we know that there's always more that we can do. And we are thankful for our leadership's willingness to listen to us as well, and to be part of the solution and part of the process. And so I just wanted to acknowledge our administrators and our leaders and thank our students for being willing to share their voice and their concerns and their needs, and to be so thoughtful about specific strategies that can be done, and know that this continues.
All right, well, with that, I'd like to thank all three of our speakers for coming today and sharing with us. Thank you so much for your work in this area. I'm very grateful that you've taken on this research project, and I'm very excited to see how UAB continues to respond and support its community.